Well, good morning and welcome. My name is Bert from Meurs. I'm the Chief Business Leader for Precision Diagnosis Image Guided Therapy. I'm here together with my colleague Shez Partovi, who is the Chief Business Leader for Enterprise Informatics. And we're honored to have us here Dr. Manjiri Dighe, who is the Chief Body Imaging and Medical Director of Ultrasound at the University of Washington Medical Center in Seattle.
Thank you.
And we're here live from RSNA. We're here at the booth floor, which will open in just an hour. And as you can see, we're showcasing here many of our innovations that we want to also discuss with you during this 30 minutes. So first, if you look at the discussions we're having with our customers, it's all about the challenges they have. If we talk about innovations, we really need to understand what the needs of our customers are. And these needs are changing and becoming more and more challenging. There's a huge pressure on the healthcare system. There's staff shortages and burnout. There's an increasing chronic and complex disease. And there's a data explosion. The amount of data that our customers are facing is growing. And that's because of the technology and the innovations that we also provide. There's increasing volumes of patients and there's cost pressure in outpatient settings. And healthcare providers, they recognize the need for accelerated digital transformation. And there's really a tremendous need of change in order to face these challenges. If we want to come with better health outcomes, improve patient experience, improve staff experience, and lower the cost of care. And if you then look at radiology specifically, which is the key focus, of course, of the RSNA, especially in radiology, we see unprecedented challenges and stress in the system. 50% of patients actually don't adhere to follow-up of imaging. And if you look at the amount of healthcare data that is provided, 36% of that is expected to grow by the year 2025. So it's really an explosion of data. 7% of patients do not show up for their appointments. And 97% of the radiology departments are unable to meet reporting requirements, where today 45% of radiologists actually report symptoms of burnout. So again, there's tremendous stress on the system, and therefore if we look at innovation, we need to come with technology that do not burden our customers, but empower them. And we need to see beyond these challenges, to see how we come with solutions for our customers to actually have more time to focus on things that truly matter, which is caring for patients. And therefore, if you look at the solutions that we present here at the RSNA, our solutions are really designed, first of all, to improve patient outcomes. Very much enabled also by AI, looking at more predictive diagnosis, more consistent, then also looking at optimizing workflows. So deploying AI to see how we can integrate with informatics and become much more efficient in how we do our diagnosis. And then finally, maximize the lifetime value across the life cycle of the system. Also there using sustainable solutions, but also deploying services along the life cycle of the system. So very important that our solutions truly deliver efficiency, consistency and productivity so that we give more time to our customers to focus on their patients. Now let me go through a number of the innovations that we actually are showcasing here at the RSNA. First of all, ultrasound. And we're very excited to present a complete new generation of our ultrasound systems with the Epic Elite and the Affinity ultrasound systems. And especially for sonographers, but we will hear Dr. Dighe talk about that later, the challenge is an increase in patient volumes while facing with tremendous staff shortages. So there's not enough time to care for patients while the case is becoming more complex. Therefore, with this next generation of our systems, we have automated the way we can do a diagnosis with a very common user interface, with compatibility of transducers so that you can use them across the different systems, and advanced collaboration capabilities so that you can consult with your colleague at a different location during the case. We are introducing AutoScan, which reduces the number of button pushes by 54% in order to improve our workflow efficiency. We are introducing Flow Viewer, which is a 3D-like vascular flow. And on the apical lead, we are now introducing contrast-enhanced ultrasound, which is a super resolution ultrasound, which improves 200% of the spatial resolution. But we will hear more from Dr. Dighe later about our ultrasound portfolio. But also very important, as part of the discussion we are having here at RSNA, is sustainability. So not only how can we come with solutions that are better for the planet, but also improve health equity and access to care. And we're very proud to introduce here the world's first and only mobile helium-free MR operations MR, which is our MR 5300 1.5 Tesla in a truck. And therefore it makes it accessible to healthcare systems and provide more access to care also in the more remote areas. This is a fully helium-free operations MR, and therefore there's zero helium refill. It is 900 kilos lighter and therefore easy to place in a truck and provides a sustainable solution for mobile MR. It comes with an easy patient setup in less than 1 minute, offering workflow efficiency through smart productivity. And also integrated in this truck is our ROC solution, which is the Radiology Operations Command Center, for better patient compliance, and therefore you can address patient review from remote locations integrated in this solution. Now, I already mentioned sustainability is a very important topic. You may know that 4% of all carbon emissions in the world come from healthcare, and especially in radiology we see this as a tremendous contribution, and these are very sobering numbers. Therefore, we are partnering with our customers to see how we can further decarbonize healthcare and develop more sustainable radiology. Here are 4 examples with Champelimo from Portugal, where we are working together to see how we can further decarbonize their footprint in diagnostic imaging. We're working together with Rennes University in France, where we have a 5-year strategic partnership. And we have started a research project together with the Vanderbilt University Medical Center in Nashville. And actually tomorrow we will present the results of this research study, which the initial results already show that we can reduce by 20% of the carbon footprint in the radiology department. And we do the same also with Temporary Heart Hospital from Finland. Now, also being showcased here at RSNA are a number of solutions and new innovations that further help to see beyond these challenges and to see how we can further improve the workflow, drive more consistency and efficiency for our customers. And there's too many to mention here, but this is just a few from the innovations that we have here at the booth floor. First of all, our new DXR digital X-ray radiography solutions, both a ceiling suspended radiography, the 7300C, as well as a new mobile system. And this comes with automatic collimation, AI enabled to automatically detect for chest X-ray, and therefore you can examine more patients per day because of this automation. Also our CT portfolio, we have the CT 5100 Incisive, which contains the fastest AI reconstruction on the market using precise imaging. And we're introducing our next generation Azurion biplane, which is further optimized for neuro interventions. But with that, let me hand over now to Dr. Manjiri Dighe to tell us a little bit more about the collaboration that we have with Ultrasound. But maybe you can first introduce yourself.
Sure, yeah. Thank you for having me here. It's a great pleasure to be here. So my name is Manjiri Dighe. I'm the Director of Ultrasound. I'm a professor in radiology at University of Washington. So if people don't know University of Washington, so we are located in Seattle. We have multiple hospitals, 4 large hospitals, multiple outpatient centers, and that have ultrasound, CT, MRI as well, and all that sort of gets fed into the main hospital. So mostly we do have people out in the main, the larger hospitals, but a lot of exams get done outside and then get fed into the main hospital. So if you look at it, since I head the ultrasound department, I can be a little more specific about ultrasound. We do more than 200 exams in a day at all the locations, and we have, at a time something like 30 to 40 sonographers that are working and sending these exams in. So it's a busy center. We also do a lot of complex exams because we do, in addition to oncology, we also do liver transplantation work. That's sort of our main focus. So it's busy. But that's where ultrasound and the machines from Philips, with our partnership that we have, it helps a lot because, as you mentioned, when you have reduction in the number of button clicks on ultrasound with the next generation Epic Elite platform, that helps my sonographers a lot because there's a lot of overburden workload on the sonographers as well when they're doing the exams. So having stuff like the auto scan where they don't have to fiddle with the machine too much, but really be able to give those high quality images to us helps quite a bit. The new transducers that have come, Philips has introduced, again, getting more information and more bang for our buck in a sense when we're imaging patients helps. And since we do a lot of complex cases, having technology like contrast enhanced ultrasound, but having the super resolution in that gives more information to me that I can then use to diagnose and give the appropriate diagnosis to the patient so they get the right care. So that's us in a nutshell. And having this partnership with Philips has been really great for us over the years.
Well, thank you very much. Yeah, and we very much value the partnership, of course, and that is the way we can advance also these new innovations. With that, let me then hand over to Shez Partovi, and to talk a little bit about our enterprise informatics portfolio.
Thanks so much, Bert. Thanks, Dr. Dighe. It was really interesting to hear your story, and it was good chatting earlier as well because you set up a lot of the things that I'm going to talk about here nicely. So I'm going to talk about our enterprise informatics portfolio and the new products that we're introducing here at RSNA. And Bert, you talked about the drivers for our customers, the issues they're dealing with, and the innovations that you'll see in enterprise informatics is really based on those drivers, and there are three of them. And I'm going to talk about those three before we go to the slides. So just back up on the slide a bit and hold on a second. So the three things that drive innovation. One, what we see, and we talked about this, is that post-pandemic, the radiology workforce has become hybrid. They start reading, radiologists have always been reading remotely, but during the pandemic, they started reading remotely. And after the pandemic, what we hear from customers is that there's still a persistence of reading remotely and always coming in. You and I were talking about this, and even in your practice, I think there's a bit of that going on. So there's this ask from our customers to deliver products and propositions that can be delivered seamlessly wherever the radiologist is. And that's no longer just at the hospital or just the clinic. And I think in your practice as well, you were saying there's some that's reading remotely now.
No, definitely. I mean, right now, if you look at how we are set up, I have the main hospital, we have multiple other hospitals and the outpatient clinic. So even in a regular day, I'm reading a lot of cases remote. So that's where the hybrid comes in.
Exactly.
But also the flexibility of having someone's sick and they can work from home, or someone stays further away, they don't have to travel all the way to the hospital to work, and they can work from home. So having that flexibility is definitely really helpful.
So that's thing one, is hybrid workforce. That's really the hybrid, go wherever the radiologist is. The second thing, hold on a slide, I'll let you want to go next, go back, you're in a hurry. The second thing that has been driving innovation for us is that there is an incredible shortage of workforce, and you talked about that, Bert. And so what customers are asking us to do is to innovate in ways in which we can leverage workforce in one location in other locations. In fact, you mentioned that you have folks in outlying areas that do scanning, and then the images come centrally. And what we heard is, how do we allow that to happen? So we're going to talk about some of the innovations that allow that to happen, and some of the innovations that allow analytics as to how do you maximize the right size, the workforce to where it needs to be. So that's thing 2, is workforce shortage drives innovation as well. And I'm going to show that in a second. Thing 3 that drove the innovation pipeline here is, and you talked about that, Bert, as well, is the explosion of data. You mentioned something like 36% data explosion by 2025. And what we see and what customers told us is there's a wealth of data and a poverty of insights. That we don't just want data, as they told us, as radiologists, we don't just want data, give us the meaning behind the data. How do you use AI-enabled tools to give the meaning behind it? So those 3 things drove innovation lifecycle in our informatics. Hybrid workforce, shortage of staff, and cognitive overload and burden, and how do you reduce the burden from data. So what I'm going to talk about is the innovations that listen to our customers and then bring forward the things that address those things. So let's now go finally to the first innovation that we announced. And you saw the press release this morning, and this is our next generation view PACS, which is Health Suite Imaging, and we moved our PACS to the cloud. And we did that not just because cloud is interesting, but because it addresses that hybrid workforce. What customers told us is, look, if the PACS is in our data center and our radiologists are remote, it's actually hard for them to come get the data from the data center, but if it's in a cloud and delivered seamlessly at high speed, and I invite you to come if you're here to showroom floor, you'll see the blazing speed of Health Suite Imaging delivered from the cloud. And so this was one of the ways in which we addressed that hybrid workforce need. And what we did is we've created a cockpit for the radiologist where the interpretation, the reporting, and the orchestration of the image flow is all in one cockpit in Health Suite Imaging. That is a radiology workbench, a workplace for them to be able to do their work efficiently, effectively, and so to be able to address that need of the hybrid workforce, meet the radiologist where she is, where they are. And so this is one of the innovations we announced today. You saw the press release, Health Suite Imaging. And actually the other thing that we heard from customers on this is a +1 on this, because the IT departments also told us, and I know that it's always a struggle to try to get the right sort of right sizing of the technology in the data center. IT departments also told us, thank you for moving this finally into the cloud, because imaging is large payloads, it needs to be compliant, regulatory safe, secure, and we deliver all of that. As Philips has a 24/7 follow the sun network operations center that when we deliver Health Suite Imaging from the cloud, we're managing as a compliance, we're managing cybersecurity, we're doing all that turnkey for the customer, and therefore that makes it even easier for the IT department. In addition to the radiologist, we have that benefit. So that was the first thing that you would have seen here if you were here. So now let's go to the second one. And so I mentioned the workforce shortage, and you talked about distributed technologists, of course, in ultrasound. Radiology Operations Command Center is, and you mentioned that because embedded in our mobile MR, what it does is it leverages, if you have skilled individuals in one location, technologists, radiographers, and then you have outlying areas, and you have perhaps, you want to do a complicated scan where the skilled person that knows how to do that scan is in a central location, they can connect and remotely oversee the scanning in the remote site. A great example is cardiac MR. Cardiac MR is hard. Programming the scanner to do that is not for the faint at heart, no pun intended. And so when you have outlying areas where you have a technologist that might want a reassurance of somebody who's an expert, they can beam in, if you will, on the Radiology Operations Command Center and make sure the scanning is done to the highest quality and it's done first time right. Reduce recalls, improve throughput, patient satisfaction, and of course the quality for the radiologist to read out becomes really important as well. And then the other thing in this announcement, so that's Radiology Operations Command Center, right sizing workforce because you have a shortage is one of the things that Performance Bridge does, and that's also announced here. Performance analytics is basically the ability to analyze your department to see the throughput, the staffing to scanning ratio, for the administrator to really dive deep into the analytics of their entire operation, their business, their radiology. And so that gives you all the graphs, all the analytics to say, am I right sizing my staff? Next Friday, do I need more staff, less staff? What's the trends? And so performance analytics embedded in Performance Bridge is another thing that allows to do that.
Yeah.
You want to say something?
So I wanted to add, in terms of the real-time collaboration, you mentioned that you have people at different sites, and you gave an example of cardiac MR. But I also wanted to add that we have a lot of junior sonographers. They're right out of training, and being able to ask maybe a senior sonographer before they actually come and talk to the radiologist, and just have that assurance, or even guidance, as you mentioned. I think that's something that ROC could definitely
Absolutely. This is the workforce load balancing, almost, and education load balancing. We see that incredibly valuable, and it's one that customers are really benefiting from. So that was the second sort of batch of innovations. Let's go to the last one. So I talked about the explosion of data, the wealth of data, the poverty of insights, and our customers are turning to us and saying, look, the workflow is becoming difficult and burdensome. The cognitive load is really high. How can you use AI-enabled tools to make the right thing the easy thing, to take out friction, to convert data into meaning? And so our advanced visualization workstation, which is here as well, has over 50 AI-enabled tools that allows for the sophisticated post-processing of imaging, understanding cardiac ejection fraction, the volume of tumor, the volume of the brain, all the things that are, if you remember, when you're practicing, I used to practice, the measurements are, you mentioned that actually in the measurement is click, 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 doing it all manually, and now we're using AI to automate a lot of the activities that normally would have taken manual processing and would have been a cognitive burden and load, and actually would have reduced, if you will, the efficacy and efficiency of whether it's the radiologist, technologist. And so the advanced visualization workstation has all those AI-enabled tools. And in fact, the other thing we did is, again, following that radiology cockpit concept, that radiology workspace, we integrated advanced visualization workstation with the PACS Health Suite imaging. So now, if you're reading a study, when the radiologist is reading and interpreting a study, they can dynamically move into the sophisticated advanced environment, do volumetric, AI-enabled analysis, and then go back to their workspace and continue and report out. And so that's the other thing that we enabled in this release, and you'll see that here. And there's one last thing. Because what you told us, what the customers told us, what your colleagues told us is, okay, Philips, you're going to build AI tools, got it. But there are other AI algorithms out there that you may not have built, but that are really good. And we want to embed those in your health suite imaging. And so it's not enough for you to say, we have great algorithms, we were told. You should be able, a customer said they want to be able to embed algorithms from other companies into our PACS environment. And so we built AI Manager, and we released that here as well. And AI Manager allows our customers, our clinical partners, to say, we'll use Health Suite imaging, but we're going to bring an AI algorithm from another company and embed it into workflow. That's the key thing. Because remember, cognitive burden, we don't want them to Alt-Tab and switch to another environment, do something, and then have to come back. And so AI Manager allows those third-party AI algorithms, and there are over 100 of them now that are available, that you can pull in and the radiologist can use. So that, again, that concept of workspace where you have interpretation, reporting, advanced visualization, third-party plugins, all coming into one cockpit for the radiologist to do her work. So those are the things we announced here. If you're on the show floor, come see them. And with that, Bert, I'll pass it back to you.
Thank you very much, Shez. That's fantastic. Yeah, I think most important what you see here, that it is not just about the imaging. It's about the integration, informatics in an open ecosystem, all in order to see how we can further optimize workflow and maximize lifetime value. Thanks a lot.